Daniel Andrews beginning his news conference now.
852 aggregate confirmed cases of coronavirus in Victoria. That is 179 new cases since we last updated you. I'm saddened to have to update you that there are now 385 Victorians who have died as a result of this global pandemic. That's an increase of 9 since yesterday's report. Our thoughts and prayers, our best wishes, our sympathies are with each of those families. This will be an incredibly difficult time for them. I can provide you with some further information. 1 male in their 60s, 1 female in their 70s, 2 females and 2 males in their 80s, 2 females in their 90s and 1 male in his 100s. 7 of those 9 deaths are linked to aged care outbreaks. There are 626 Victorians who are in hospital. 40 of those are receiving intensive care and 25 of those 40 are on a ventilator. A total of 2,049,235 test results have been received. That is an increase of 20,326 since yesterday. I'll come back to testing in just a moment. There are 3,808 cases with an unknown source. That is an increase of just 24 since yesterday's report. Health worker infections, which remain a significant challenge for us, 668 healthcare workers who are active cases. There are 1,732 active cases in aged care settings, and the total number of active cases across the state, 4,421. In terms of the regional metro split, we have, in terms of the new cases, there are about 15 of those new ones we've reported today that are in regional LGAs. There's a number that are still being investigated, but in broader terms, 4,022 in metro under stage 4, some 269 in regional Victorian communities under stage 3, and there's always that number that's still being reconciled and being investigated by our coronavirus detectives. I was just talking with the Chief Health Officer about it wasn't so long ago that we were reporting about 512, I think was our top number in terms of active cases in regional Victoria, with some concentration in Geelong, Bendigo and Ballarat. So to see that number coming down is very important to us, particularly in those larger cities. There are, in Greater Geelong, 109 active cases, Greater Bendigo, 25 active cases, Ballarat has 13 active cases. So those numbers are falling and or stable, and they relate principally to a number of larger outbreaks. And once their 14-day period or whatever the equivalent finishes up being for them, we should see those numbers come down further. I wouldn't want that to have any sense of complacency in the minds of any regional Victorian. These numbers are low, they're trending in the right direction, and that's good. But please come forward and get tested if you have any symptoms whatsoever, and that remains the message right across the board. To be up above 20,000 tests for the day yesterday, that's a fantastic effort. To be over 2 million tests now is a very impressive thing, but we've just got to keep those testing rates up. We've got to make sure that people are coming forward, even with the mildest of symptoms, as soon as you get those even mild symptoms, and then stay at home until you get your test result. It's a massive, powerful, critically important thing that every Victorian with symptoms can do, and it will get us to the other side of this quicker. We did see a little drop earlier in the week, but those numbers are now back in a frame where we're confident that we've got a good, solid picture, the surveillance benefit of that, so a sense of what's going on across the Victorian community. But the more people with symptoms who get tested, the better off we'll be to try and drive these case numbers down. That's the truest picture and the most important thing in many respects that Victorians who've got even mild symptoms can do. Please come forward and get tested. There's more than 190 sites across the state. We'll get your result back to you as quickly as we possibly can. And in doing that, you will have made a massive contribution to us getting to the other side of this second wave. In terms of just a couple of other updates for you, aged care, 1,732 active cases and 126 outbreaks. In terms of shifts that have been worked by hospital nurses. That number has now grown to 2,246 shifts. And I'll again take this opportunity on behalf of all Victorians, and particularly, if I may, on behalf of families who've got loved ones in aged care, to thank each of those nurses, personal care attendants and others who are doing an amazing job, leaving their normal hospital job to go and work in an aged care setting that is under considerable pressure and stress. That's a really important contribution, and we're deeply, deeply grateful to each and every one of them.